Hello everyone, this is Health Angel Solutions again. The symptoms of a high TSH, also known as thyroid stimulating hormone, will be discussed today. We will also discuss which symptoms are linked to a high TSH and help you define what a high TSH is, as that is somewhat controversial. We will also help you determine whether your symptoms are related to your TSH or something else. At Health Angel Solutions, we specialize in treating thyroid problems, helping people balance other hormonal issues, and then helping patients lose weight. I take a functional and integrative approach to these issues. So if you're interested in any of these topics, please subscribe and click the notification bell, because I think you'll enjoy what we're going to be discussing. Now let's get started on our topic, which is high TSH symptoms. We really need to define a little bit about the thyroid's physiology before we discuss the ideal levels. After that, we'll discuss the symptoms that come with having a high TSH. Let me first reorient you to the area of your body that we are discussing. The pituitary gland in your brain secretes the hormone TSH, which is the main focus of our discussion today. It is not the most significant theory test, by the way, but it is the main focus of our time and attention. The thyroid's functioning begins in the brain, travels to the thyroid gland, and then travels to the rest of the body. This process is known as a feedback loop. Now, there's a little more complexity down here, but we won't go into that because that's for a different topic. Conversion and cellular activation and other things like that are important, and you should know about them now. But let's focus on the TSH. The pituitary gland actually produces TSH, which acts on the thyroid and tells the thyroid gland to pump out thyroid hormones, T4 and T3. What confuses people is that a high TSH is linked to low thyroid levels. In the feedback loop I'm referring to, your thyroid gland produces T4 and T3, which return to the pituitary and tell it, "Hey brain, we have enough thyroid hormone. You don't need to produce any more TSH, and you don't need to tell the thyroid gland to produce any more." So, a high TSH indicates a low or sluggish thyroid gland, which can be confusing because you might think that it means we're producing too many hormones. However, what happens if these values drop? If the T4 and T3 drop in the serum, they drop in your peripheral tissues. They don't then go back and tell the brain, "Hey, we don't have enough." In other words, the brain says, "Oh, I know what to do. We're going to increase the TSH, and we're going to try to tell the thyroid gland, we're just going to push on it like the gas in your car, trying to force your thyroid gland to produce even more thyroid hormones." This is how that feedback loop works, which is why a high TSH is almost always linked to low thyroid function or a sluggish thyroid. Yes, there are some more subtleties there, but we won't focus on that. That's why having a high TSH is important. If you've heard me discuss other topics, like other TS values, I've previously discussed having a low TSH and why that's a little more confusing. If you haven't seen that video yet, I strongly advise you to do so right away. However, today we're talking about a high TSH, and it's much less confusing because, with rare exceptions, having a high TSH is almost always going to cause hypothyroidism. This is because a high TSH is linked to a low amount of thyroid hormones fluctuating in your body. Because TSH has a wide range of options that you can test at any time. If your doctor takes a test in the morning and says, "Hey, your TSH is fine," and you say, "Well, wait a minute, I have fatigue, I have weight gain, I have all these things," you may be experiencing hypothyroid symptoms due to low T4 and T3 levels. We'll discuss these symptoms in a moment, but first, let me explain what kinds of ranges you should be looking for. According to your doctor, there is a distinction between the ideal range and the standard or usual range. Nowadays, the majority of doctors are taught to look at things in a certain manner, and they base this on the reference range of the lab test itself. They won't even tell you. There is a range there because it depends on the test and the lab company, but generally speaking, your doctor might say that if your TSH is out of range, "Hey, you've got an issue now." until your TSH is greater than 4.5 to 5.5. You have a thyroid issue. However, more recent research has demonstrated that a TSH of 2.5 or 2.0 to 2.5 is actually problematic. This has been confirmed by examining different healthy populations of people and asking them when they first developed thyroid issues. It turns out that many of our earlier studies were complicated by the fact that many people have undiagnosed Hashimoto's disease. So we included those individuals in these population studies and ended up finding the incorrect range as a result. However, since these studies are new, your doctor might not be aware of them. Therefore, what I'm saying is that the ideal range is one in which you probably won't experience these symptoms, and we'll talk about it. It's somewhere above a TSH of 0.5 to 2.5, but somewhere in between that range, so 0.5 to 2.5, but definitely less than 2.5. If you start to get above the 2.0 to 2.5 range, that kind of depends on the studies, but in my opinion, 2.0 is the best. However, I've included this 2.5 here to give us some leeway because if your TSH is higher than that, you're almost always going to have hypothyroidism symptoms because that's another sign that your thyroid isn't working properly. Now that you know that, let's talk about the symptoms you might be experiencing because, once more, you're going to be told that your thyroid is fine. For example, if your TSH is 3.5 and you say, "Hey, I feel really poorly," your doctor will respond, "No, it's definitely not the problem, since they fall into this range. But if you fall into my range, you're a touch off." All right, so what symptoms am I referring to here that are connected to this thyroid? These are the signs of hypothyroidism. You see, it's on a spectrum. For example, a test of 3.5 may only have 5 to 10 pounds of weight gain, but a TS of 7.5 may have 15 to 20 pounds. Remember, hypo means low, so low thyroid hypothyroidism is what we're really talking about. These symptoms begin with things like weight gain, which can be slight or significant depending on how poorly your thyroid is functioning. Therefore, weight gain is dependent on your TSH levels, and the greater your TSH is, the more likely you are to have these symptoms. Hair loss is also a major concern. It is not a typical indicator. No matter how old you are or what else is going on in your body, hair loss is always a bad sign. It could be an indication of a nutrient deficiency, or in this case, a thyroid or hormone issue that causes infertility. Infertility is typically a later sign, but because people are so unhealthy these days, it can appear even when TSH is between 2.5 and 2.6. Therefore, optimizing TSH is crucial if you're experiencing infertility problems. Fatigue or low energy is another major issue. Again, a variety of factors can contribute to fatigue or low energy, but it's undeniable that having a high TSH can cause these conditions. Another issue is muscle pain, which many doctors frequently overlook. In fact, I have a really important article that says that if you're experiencing muscle pain, you should definitely check your thyroid levels, including fibromyalgia, as fibromyalgia can be linked to low T3 levels, which is another condition that doctors frequently overlook. Dry skin, I hope you can tell that their skin is dry. Another is dry skin. So you feel like you've never had dry skin before, and it's not really the cold winter months or the dry season, and you're experiencing flaky or dry skin. That's also very unusual. Furthermore, a low heart rate. We're talking low, probably less than 70, somewhere between 60 and 70, maybe in the 50s, means that you're not a conditioned athlete and your heart rate is 55 and you're not taking a medication that lowers it. You have a problem. That is not typical. It's normal if your heart is really well conditioned and you're an athlete or fitness enthusiast. But if not, that's a problem that needs to be addressed or at least looked at. This is frequently linked to a low body temperature. So people with this high TSH frequently can't handle cold at all. These are the people who wear socks to bed even in the summer, even when it's 78 degrees, or perhaps 80 degrees, or something like that, and they're wearing a jacket. You know that's really not normal, like when everyone else is wearing only a t-shirt and shorts and you need a jacket and jeans. That's a sign that something is wrong, and that's usually your body's ability to regulate its body temperature, which is managed by these hormones. It's very important that you have depression, but this time it's not a good depression. Instead, it's a sign of having a high TSH. Depression in this situation tends to happen without any kind of trigger or cause. So if you're just depressed and you don't really have a reason to be depressed, that's a problem, right? You shouldn't just be depressed. You should still enjoy the things you do on a daily basis if you're not experiencing that. Another major problem I see is brain fog, which is the inability to focus to pay the attention you used to or to perform well at work or your job. There are many things that can cause depression and brain fog, but if you have these symptoms along with other symptoms like fatigue and weight gain, you're beginning to paint the picture that these are all related to your thyroid and TSH. Okay, so here's another one, irregular menstruation, which is somewhat related to infertility, as we discussed. But if your cycles are becoming regular and you're in your 30s or something, and you can't attribute it to perimenopause or menopause, that's obviously a problem. Finally, constipation is another major issue for a low thyroid. What happens is that your thyroid regulates the transit time in your gut. So if your thyroid is low, guess what? Your gut slows down, which leads to bacterial overgrowth, fungal overgrowth, and a host of other problems in your gut that need to be addressed. In conclusion, understanding high TSH symptoms and knowing what's considered a normal TSH level is essential for managing your thyroid health effectively. As we've discussed, high TSH levels can indicate an underactive thyroid or hypothyroidism, and it's important to recognize the signs early, such as fatigue, weight gain, cold sensitivity, and more. Regular testing and timely medical consultation can help you maintain balanced thyroid function and prevent complications down the road. Remember, each person's body is different, so what's normal for one person may not be for another, which is why personalized care and attention are so crucial when managing thyroid health. We hope this video gave you a comprehensive understanding of high TSH symptoms and how to monitor your thyroid function. If you or someone you know is experiencing any of the symptoms we've covered, it's always a good idea to speak with a healthcare professional for further evaluation and guidance. If you found this video helpful, please like it and share it with others who might benefit from this information. Don't forget to subscribe to Health Angel Solutions for more health tips, informative content, and expert advice on maintaining a healthy lifestyle. Your support helps us reach more people and provide valuable health insights. Drop any questions or comments you have below. We'd love to hear your thoughts or personal experiences with thyroid health. Thanks for watching, and remember, knowledge is power when it comes to your health.